Our next presentation will be given by Ann Petersen. Ann is one of the nurse practitioners who is our entry point to the sleep clinic. She has helped many of my patients, and she is obviously excellent at not only diagnosing, getting people on the path, but coaching them along the way. So she has a long work history of being active in this field, and I think she will be able to help us all today. So please help me welcome Ann Petersen.
Thank you, Dr. Coe and Dr. Meyer, for inviting me to speak. My topic today is obstructive sleep apnea in women. Sorry. I don't have any disclosures. My objectives for today are to provide an overview of OSA, or obstructive sleep apnea, discuss the gender differences associated with OSA, review the risk factors and medical illnesses that increase the risk of having OSA, review the health consequences that are associated with long-term untreated sleep apnea, discuss methods to diagnose and treatment approaches, and finally end with some case studies. There are several types of sleep apnea, but due to the time factor today, I'm only going to speak on obstructive sleep apnea. So obstructive sleep apnea is the most common type of sleep apnea. It occurs with a decrease or complete halt of airflow, despite ongoing effort to breathe. Muscles in sleep relax, causing the soft tissue in the back of the airway to collapse and block the upper airway. It leads to partial. I'm sure you had enough time to read through it, though. Obstructive sleep apnea is the most common type of sleep apnea. It occurs when patients have a decrease or complete halt in airflow, despite the effort to breathe. Muscles and sleep relax, causing the soft tissue blockage in the back of the throat and block the upper airway. It leads to partial or complete reductions in breathing. The partial reductions we call hypopneas, and the complete reductions or pauses we call apneas, and they have to last at least 10 seconds. Just an image of an obstructed airway and an open airway. When we look at patients with sleep apnea, we have a severity score. We use an apnea-hypopnea index, and many times people are kind of questioning what that really is. So apnea stands for pauses in breathing lasting at least 10 seconds, and they have to be associated with a desaturation of 4%. Hypopnea is shallow breathing that also drops the oxygen sat by 4%, and indexes the events per hour. Everybody in the world can stop breathing less than 5 times an hour, and it's completely normal, which sounds very unusual, but it is.